I asked over 100 medical professionals to give me their tips on movement as it relates to their medical specialty. This video might change your life.
Hi, I'm Dr. Sheena, a virtual functional medicine doctor specializing in gut health, nutrition, and inflammation. When it comes to movement, one of the most underrated tools for gut health, blood sugar balance, and hormone regulation is muscle building. Strength training just isn't for swimsuit season. It literally creates more storage spaces for carbs, reducing insulin spikes, and preventing excess sugar from turning into fat. Plus, muscles can release anti-inflammatory compounds that support gut health and hormone balance. My top tip, prioritize strength training over endless cardio. Just 20 to 30 minutes a day of resistance training a few times a week can transform metabolism, improve digestion, and help balance out hormones like estrogen, testosterone, and cortisol. Muscle is medicine, and building it is one of the best things you can do for your long-term health.
Hey Dr. Brent, thanks for having me for this awesome project you're doing on movement and how it affects different parts of medicine. My name is Dr. Seth Breaker. I'm a general dentist at Small Town Dental, and for some reason there's this perceived disconnect between the mouth and the rest of the body, whereas in fact there's this direct link. So patients that are exercising regularly, whether that be cardio or just strength training, there are benefits that we see in the mouth, and that is increased saliva flow, increased blood supply to the gums, which then results in a decrease in the chances for gum disease, such as gingivitis or periodontal disease. These patients also are less likely to grind or clench their teeth because they're able to relieve stress in other ways. So these are just a few of the benefits that we see in dentistry every day. So thanks for having me.
Hey, I'm Dr. McNabb. I'm a chiropractic physician down in Boca Raton, Florida. And my best advice for people regarding movement and health is to simply move more. We have to move more. We are a society that sits and doesn't move nearly as much. Many of us are sitting on computers, and a lot of us that work on computers are working from home, which means you're moving even less. But regardless of what your profession is and what you're doing, you simply just need to move more. Every system in the human body relies and requires on movement in order to really be healthy. Your cardiovascular system, your pulmonary system, your digestive system, and quite possibly the most important is your nervous system. Your nervous system is comprised of your brain, spinal cord, and nerves, and the health of that entire system very heavily requires movement. In fact, Roger Sperry, who is a Nobel Prize winner for his research on brain development and health, he found that 90% of the stimulation and nutrition your brain receives is directly a result of the movement of your spine. And so if your spine isn't moving, if you're not moving, if you have bad posture, if you're stuck at a desk all day, if you have arthritis and degeneration and your spine just doesn't simply move, if you feel like you have a stiff neck or a stiff back, or if your back and neck hurts in any way, my best advice is to seek out chiropractic help, because the movement of your spine is very, very, very vital to the health of your brain.
Thank you so much for having me, Dr. Brent. My name is LEXIE Woods, and I'm a registered nurse, and I specialize in labor and delivery. Exercise throughout a woman's pregnancy is super important. It may even help reduce the risk of certain complications that could arise during pregnancy. This could be gestational diabetes or preeclampsia. A woman's body is changing a lot throughout pregnancy, obviously, so just getting up and moving around could help your mental health immensely. Now, typically where I see patients is when they're coming into the hospital in labor, getting ready to have a baby. If they've stayed moving throughout that pregnancy, they might have an increased stamina and energy that'll get them through the labor process. It's very, very simple to get yourself moving during pregnancy. You could go for a walk, take a yoga class, do Pilates. Very simple ways just to get your body moving and get yourself feeling good during pregnancy. Thank you.
Hey everyone, thanks for having me. I'm Lance Harley Lewis. I'm a physical therapist with an expertise in advanced manual therapy and sports medicine. One of the best things that you can do for your health is strength training. A lot of people focus on staying active, which may be great, but it's not always enough to prevent muscle loss, osteoporosis, or even arthritis or osteoarthritis as we age. Over time, we naturally lose muscle mass and bone density, and that can lead to injuries, mobility issues down the road. Strength training helps keep your muscles strong, your joints stable, your bones healthy. It doesn't mean that you always need to lift heavy weights at the gym. Even a body weight exercise at home can make a big difference. So if you're not already doing some form of resistance training, start small. A few strength exercises a couple times a week will go a long way keeping you moving well for the years to come. Hope that helps. Stay active, stay strong, and take care.
Hi, Dr. Brent. My name is Dr. Katie HOGUE, and I'm a pelvic floor physical therapist. The one thing I stress with all of my patients is the importance of breathing. We have a pressure system with our diaphragm at the top and our pelvic floor at the bottom. When we breathe in, that flattens the diaphragm, increasing the pressure in the belly, and that pushes down the pelvic floor. And then when we exhale, our diaphragm comes up, reduces the pressure in the abdomen, and that causes the pelvic floor to lift as well. Holding your breath can create extra tension through the ribs, abdomen, and pelvic floor, leading to issues like pelvic and back pain, urinary and fecal incontinence, prolapse, and more. So pay attention to your habits. Do you notice that you're holding your breath throughout the day when you're anxious, or even with lifting and exercise? If so, make sure you're breathing through those movements, and also just check in with yourself throughout the day and making sure that you're breathing properly with rib expansion and abdomen expansion. You'll definitely see the difference.
What's going on, Dr. Brent? Thanks for having me. I'm Dr. Ryan BIELECKI, owner and chiropractor in Downers Grove, Illinois, here at Spineco Chiropractic. What is my best advice for patients regarding movement and health? Honestly, the number one bit of advice that I give all of my patients is finding 15 minutes per day to stretch your body. You can split it up. You can do 15 minutes one day upper body. You can do 15 minutes the next day lower body. Everyone always says they have difficulty finding time to put this into their schedule. I always ask them, do you watch Netflix at the end of the day? Do you watch TV at the end of the day? Find 15 minutes during your show or during your episode or during your movie, whatever it is, and incorporate your stretching while you watch. This way you can integrate it into your day and you don't always have to find time for it. The time's always there, you just have to make it.
Thanks for having me, Dr. Brent, and hi everyone. My name is Amanda Brewer. I'm an athletic trainer and I work with a Division I football program. We really embody the philosophy that movement is medicine with our student athletes by promoting a proactive stance in their healthcare that starts with them getting a proper warm-up in before their strength and conditioning sessions or practices. If I had to pick one tool in our athletic training room to provide to our student athletes or recommend to our student athletes, it would be a foam roller. This is very versatile. You can use it as a warm-up for your muscles, working on any areas of tension, increasing blood flow, and then additionally you can use it after your workouts or after your practices to again increase your blood flow, which is going to improve your recovery time, and then also to reduce any muscle soreness.
Thanks for having me, Dr. Brent. My name is Brody Woods and I'm an attorney here in Peoria. Movement for me is a big part of my day-to-day life, as I'm required to sit quite a bit as an attorney. Making sure I get up and stay active helps me focus more and also helps me relieve back and joint pain that might come from sitting all day. Another big part of my job is reading, which in turn requires a lot of screen time on the computer, so focus is essential to make sure that I get my work done and get my work done at a high level. I recommend watching Dr. Brent's videos that have been posted on various social media platforms that recommend stretches and movements that you can do throughout the day to improve your well-being. Lastly, I've seen a dramatic increase in the way that I feel from seeing Dr. Brent on a regular basis and utilizing chiropractic services. I think this can help everybody. Thank you so much for having me, Dr. Brent. I appreciate it.
Hey, Dr. Brent. My name is Andrew Seymour, owner of Seymour Health and Fitness, a personal training business in the Des Moines area. This is my CEO, Cleo. My advice for patients regarding health and movement is to find consistency. In order to reap the benefits that you're looking to obtain, we've got to do so with a consistent effort. It can't just be show up once. It can't just be a fad of 60, 90 days. It's got to be something that you can do long term. So my advice and my tip to end with would be find something you enjoy doing. If you enjoy doing something, there's a better chance that you'll stick with it long term, and there's a better chance that you'll want to show up on those days that are maybe a little bit more difficult to show up for yourself. Thanks.